Yeah, thank you very much. As you see, I am a surgeon in this country based in Watford General Hospital. My background coming from Iraq. I've been living in this country for it's about 30 years. I got this interest in mass gathering from both Hajj and from Arba'een. Hajj because I have been there for about 8 times as a volunteer doctor and collected a lot of interest in the health and the well-being of Hajj. Iraq is a country of 35 million. If you see that we are talking today about Arba'een in Karbala, and Karbala is south, about 100 kilometers south of Baghdad, and people during Arba'een or before, until the day of Arba'een, they walk. The majority, they walk. Please concentrate on this specific risk. They walk towards Karbala. And the range is about 50 to 500 kilometers. Let us talk about Arba'een itself, what it means first. Arba'een is the 40 days after the martyrdom of Imam Hussein. Imam Hussein is the grandson of Prophet Muhammad. And this happens, of course, every year. It is an annual commemoration of Imam Hussein for 2 days. It is about 14 days, starting 14 days before Arba'een until the day of Arba'een. Some people actually, they carry on staying in Karbala for another few days. Every year is getting more and more people. And this year, 3 weeks ago, I got these figures from the health authority from Iraq. 15 million people attended. About 3 million, this is the figures, coming from outside Iraq, and the rest from inside Iraq. People coming from outside Iraq, the majority, they are coming from Iran. This year, about 2.5 million. And most of them, they walk from Iran towards Iraq. So it could be more than 500 kilometers walk. And another 500,000 came from all over the world, including this country. I've been told about 25,000 attended this year from this country. And of course, these people actually walking, as you see, all the way outside Karbala towards the center of Karbala. Next, please. And you see people, males, females, even children, old people. The weather could be really hot. I walked this year about 25 kilometers for 10 hours. It's a unique experience, but it was really hot. And I should have actually walked over the night, not the daytime. Here, getting towards Karbala, closer to the shrine of Imam Hussein. And you see the number of people get together, getting more and more and more. Next, please. Here is the people between the 2 shrines of Imam Hussein and his brother, also martyred and killed in Ashura, Imam Abbas. And it is very, very big number of people get together around a very small area and land around the 2 shrines. Next, please. And this is, again, another view of the people get together between the 2 shrines. And you can see actually the potential risk of these 2, the big number of people visiting the Karbala during Arba'een. Next, please. This picture is inside the mosque of the Holy Shrine of Imam Hussein. And again, it can be even the biggest gathering and the most tough. And I had to really struggle to get through these people. And I found it extremely difficult to go, and that's what we usually meant to do when we go and visit the shrine, to go close to the tomb of Imam Hussein. I can't do it. It's very difficult. And because maybe I'm a doctor, I'm trying actually to avoid any unnecessary risk or giving the people the chance, but it is really difficult. Next, please. Now, let us talk about the figures. 2018, these figures I just got a few days from the health authority from Karbala. More than 4 million patients seen. Where? They have been seen inside Karbala, in 9 hospitals, and also mobile portable clinics, and also seen few kilometers outside Karbala. But we don't know how many been seen between, let us say, south from Basra to Karbala, walking over 500 kilometers on the roads. 28,000 transferred to hospital by ambulance. Where these ambulances coming from? How they can get through the crowds? The ambulance is coming from the Iraqi health authority, and also some ambulances coming from another country, especially Iran, the Islamic Republic of Iran, because they have to cover their own visitors. They are about 2 to 3 million a year, and they learned the lesson over the years, especially during the last 2-3 years. They actively involved in offering as much as they can health care and also shelters, foods, and the rest of the needs. 9 hospitals inside Karbala, 3 large hospitals with 2,100 beds, 6 polyclinics with minor injuries and outpatient services. The figures you can see, 153 major accidents happened. This is what I want to really honestly tell you, that we have to look at that and the reasons, because if I compare it between what happened in Iraq and what happened in Hajj, the major accidents hasn't happened yet, but we don't know, it could happen. We need actually to first learn from the experience of Hajj to reduce the risk of physical injuries. The death, only 19. And of course, death, it can be because of trauma or injuries, or the majority because they're all people exhausted, exposed to heat, and maybe lost control of their chronic diseases. The operations they did, they said 503 operations. Next, please. Next slide. So as I said, the volunteers, they are coming from the Red Crescent organization, Islamic Republic of Iran, Imam Medics International. I will talk about them because they gave me their own figures as well for this year. In addition to Iraqi medics, nurses, physiotherapists, and other charities, they bring their own medics and other necessary helps. Next slide, please. Right, who are they? They are medical nurses, pharmacists, all over the world, especially from the United States, from this country, from Europe, from Pakistan, from India, from Iraq. Usually, they go between 130 to 200 personnel every year, and they are based inside Karbala. This year, they have seen more than 100,000 patients. The majority, they present with respiratory tract infection, as would you expect, with some minor injuries, leg pains, back pain, exhaustion, UTI, renal colic, asthma, and MI. was about chronic illnesses. Next slide, please.
Just move to close now, please.
Sorry.
Need to move to close.
Yeah, I'm nearly there. Nearly there. So chronic diseases as well presented to them, poorly controlled diabetes, hypertension, and the other thing, this is interesting, patients take the opportunity to ask for second opinion from the experts coming from outside, and including myself. Next slide, please. Right, challenges, as you see, it is just a field medicine, and depends on clinical examinations. Very, very big volume of patients with very short consultation, and it could take 1 minute. Poor patient education is a problem because people actually coming, they don't know exactly, maybe even they cannot express their illnesses or their symptoms easily, especially they are tired, exhausted, and the rest of it. Shortage of resources. Almost on the roads, there is no diagnostic or therapeutic advanced facilities. Difficulty in transferring patients by ambulances, especially the big roads. Even outside Karbala, it could be very difficult to get the ambulances on the roads to get the patients to the hospitals. Next slide, please. Advantages, education and training of locals by the experts from outside, meeting stakeholders and decision makers, give them their feedbacks, backgrounds, their figures to improve the service and reduce and minimize the risk. Networking, strengthening ties and collaboration, exchange of ideas for better strategic plans for the future. Next slide, please. This paper, you see, published on the 2017, and they said in one hospital, including the satellite small clinics, they have seen 919,000 patients in 2015. And I would say very small number of operations done. Exactly, that's what happened this year. Most of the patients treated like, visiting a busy GP clinics. Next slide, please. Ashura, another paper published. Ashura is the day of martyrdom of Imam Hussein. And this paper published in 2013. The visitor, it is one-day event, there is no walk, and people coming to Karbala in the morning and then almost disappearing completely in the evening.
We need to wind up now.
Sorry?
We need to wind up with one more speaker to come.
Yeah, fine. One slide, please, the last one. Okay, what I would conclude, like Arba'een is a unique opportunity for studying health risk, locally and globally. Strategic measures required to minimize the risk. Well thought pre-event plans and post-event post-mortem is required and is vital. And working with another organizations outside Iraq is important, especially people actually with their experience in Hajj. I do appreciate actually the collaboration and the work, and we can talk actually together and, do that. Anyway, education of pilgrims is very important, what they need to do before they attend these meetings. What's important, what's about the important vaccinations, preparing actually themselves, getting their medicine with them for chronic illnesses, visiting their GPs is very important. And a lot of work still needs to be done. Finally, two things I want to say before I thank you for your listening. We are still in the beginning of doing the proper research about health risk in Arba'een. Second thing, that Arba'een is a unique opportunity and a lot of chances for public health research and studying. Thank you very much for listening.